Hi Jen, how's it
going?
Good.
So I had such good results with my ViVier that I wanted to bring in my friend Rose because I think she's probably going to be a really good candidate.
Amazing.
So
Welcome.
excited.
Hi Rose, how are you?
I'm so
Thanks for
excited.
being here. You got it. Well, take a seat. Let's chat a little bit.
All right.
Awesome. So tell me what brings you in?
Well, I definitely have some breathing issues. I catch myself breathing through my mouth at night. I don't wake up feeling refreshed. I can tell that on one side of my nose I can breathe more evenly than the other. And learning about sleep hygiene and everything, I knew that you were the man to come to help me out with my breathing.
Awesome. So let's go ahead and take a look and see what's causing the problem in your nose.
Okay.
All right, Rose, we're going to go ahead and use a camera to take a look inside your nose.
Okay.
And we're going to figure out what's causing the problem with your breathing.
Okay.
There's a few different areas to kind of focus on when we're looking inside the nose. The first one's the septum. The septum is this piece of cartilage in the front and bone in the back that divides the two sides of the nose. As I look inside your nose with a flexible laryngoscope, I'm going to see whether or not you have any problems with the septum.
Okay.
I'll also be looking at the turbinates. The turbinates are these small structures on the sides of your nose that warm, humidify, and moisturize the air.
Okay.
It's important to have good functioning turbinates, but sometimes the turbinates are overly hypertrophied, too large, and that can be a source of blockage to breathing.
Okay.
One often looked cause of difficulty with nasal breathing is problems with nasal valve obstruction. Nasal valve obstruction happens on the corners of the nose, right here. Sometimes when patients breathe in, that part of the nose can pinch in and cause increased difficulty with nose breathing.
Okay.
Are you ready to take a look and see what's causing the problem in your
Yes.
case? All right, let's go ahead and take a look, okay? The first thing I'm going to do is just ask you to breathe comfortably through your nose. Just breathe in comfortably through your nose. Good. And now just give me a deep forced inhale. Deep breathe in deeply. There we go. So we're seeing that on the deep forced inhale, you have a little bit of nasal valve collapse on the outside.
Okay.
Let's take a look at the inside now, okay?
Okay.
All right. Where we're going to identify the septum. Point to the septum. This is the septum. And you see the septum is nice, midline. You don't have any deviations of the septum. On the left side of the screen, point to the turbinates there. The turbinates look okay. They don't look too swollen. It looks nice and open, nice and clean. No congestion or mucus. Up higher up, right here in this corner, we see the nasal valve. This part of the nasal valve can obstruct your breathing on a deep inhale. So go ahead and inhale deeply for me. And so we see that you have both static and dynamic nasal valve collapse in this area, for which the ViVier could be one good possible treatment.
I usually can tell when I'm sleeping. I sleep on my left side, so it's better on this side.
It's better on this side. So let's look on the opposite side now, okay?
I think anyway.
All right. And then again, point to the septum here. This is the septum. It's nice and straight. Point to the turbinate. We see the turbinate's really nice and out of the way. We look higher up, and we see that again, it's the nasal valve here, causing a very minor narrowing at the top of the nose. Go ahead and do a deep inhale. And we can see that you have this static and dynamic collapse of the nasal valve. Breathe in again. You can see how it kind of comes in. Breathe in one more time. And that is what is causing the obstruction. We can see that in fact it is worse on the left side. Breathe in again. Let's take another look at your right side in the same area. Go ahead and breathe in for me. And so we'll be treating right here, this area, point to it on the screen, Gloria, of the nasal valve, okay? This is some cartilage that's pushed inwards. Let's show you how things may feel with this little maneuver. Okay. I'm just going to put this Q-tip in right in the area where we do the intervention. Breathe in for me. How is that for you?
Wow.
Oh.
Completely different.
Amazing.
Wow.
And how about on this side?
Yeah.
Okay, very good. So let's talk about the risks and benefits of the procedure, okay?
Okay.
First of all, I want to let you know that the ViVier has now been out for several years, and they've now completed high level 1 studies in the form of a randomized controlled trial showing a very significant, long-lasting improvement with patients with nasal valve obstruction.
Okay.
This is great news because before we thought it could help, but now we definitely know that it's a very useful tool to help patients with nasal obstruction, and it's going to have long-lasting results with minimal side effects.
Okay.
The major issue after this procedure is minor swelling in the area that we do the procedure, all right? What we will be doing is introducing the ViVier wand inside your nose in this area. And what the wand will do is gently heat up the cartilage in that area, allowing us to remodel it and shift it to the appropriate position inside your nose.
Okay.
By shrinking that tissue and remodeling it, you'll have a little bit of swelling on the outside of the nose that'll be most predominant over the course of the first month and will subside thereafter.
Okay.
You'll likely experience an immediate improvement after the procedure, but then you'll develop some swelling for a few weeks, and then it won't be until 3 months that you'll have the best results.
Okay.
So we want you to stay hopeful and recognize that the results are going to come after the initial few weeks of inflammation.
Okay.
All right? We're going to go ahead and start on the left side and then go to the right side in your case. All right? Do you have any questions for me before we begin?
With the swelling, what is the best way to make the swelling go down? Do I just leave it alone? Do I use ice packs?
That's a great question, okay? To help with the swelling, when I give the initial injection to numb it up, I'll also be putting a small amount of a steroid that can help to minimize the swelling, so we'll be proactive in that regard.
Okay.
And then after the fact, yes, absolutely, ice can help. Also, medicines like ibuprofen can also help mitigate the swelling.
Okay.
On the inside of your nose, you may have some crusting, and we recommend that you apply some AYR gel to keep that area nice and moist and to minimize any further injury that can perpetuate the inflammation.
Okay. Sounds good.
Great. Any other questions? Good. Let's get started. We're going to start by putting a little plugit inside the nose.
Okay.
This plugit has some lidocaine, which is a numbing medicine, and it's going to take the edge off of the local anesthetic, okay?
Okay.
Turn your head towards me just a touch. There we go. We're just going to go ahead and open this side of the nose and place this cotton with the lidocaine medicine right there and let it sit for a couple minutes. We'll just do one side and then the other, okay?
Okay.
Just take a deep breath into your nose. Let it go. Alright, first one's going to be the worst, okay? Here we go. Bear with me. Great. Did really good with that one. How was that?
Easy peasy.
Good.
Yeah. I hardly felt anything.
Great. Let's keep going, okay?
Okay.
How was that?
Fine.
Easy?
Mm-hmm.
Very good. You're doing really well, okay?
Okay.
You didn't feel the last few?
No, but
Doesn't taste too good.
tastes bad.
Yeah, it does taste bad. Would you like some water?
No, I'm okay. Thank you.
So we're just going to test it. How does it feel in here? Are you able to feel this, or is it good enough?
I could feel that.
Okay. Just give it a little more injection, okay? Let's try it out. still feeling these injections or not so much?
Not so much.
I think you're good and numb.
Okay.
So we'll go ahead and get started with the procedure, okay?
Okay.
Good. This is the Vivaer wand. It introduces radio frequency energy to the nose. It gently heats up the tissue to a controlled 60, 61 degrees. And then we apply the energy, and once it's at the right temperature, we start to remodel it, hold it in that area as it cools down. Each cycle is about 30 seconds, okay?
Okay.
Great. Let me know if you feel anything, okay?
Okay.
Doing okay?
Mm-hmm.
Right, that was our first treatment. Go ahead, take a deep breath in. How does that feel?
Feels like it's opening up.
Already, huh?
Yeah.
Amazing.
Wow. And I didn't feel anything while you were doing it.
Great. Let's do a couple more and then reassess, okay? It needs more of the gel, I think. Okay, so you'll edit out the 20 seconds, Chad?
Mm-hmm.
Alright, take a deep breath in.
Oh my goodness. It's so much better.
Alrighty, huh?
Yeah.
It's okay here, Rose?
Mm-hmm.
Maybe a little more sensitive here, okay? You okay?
Mm-hmm.
So good, yeah, that was it. Alright. So we're gonna take a little look at what we've done on that side, and then go to the opposite side, okay? Here we are, going inside the nose, just immediately after. And we're able to see the targeted area we show us on the screen, Gloria. How the nasal valve was treated, it is much more open now. Yep, right up in this corner. Go ahead and take a breath in for me. Breath in. So good. And tell us how you feel.
I can actually breathe. I have never been able to breathe that way through that side of my nose.
Amazing.
Yeah.
Amazing.
And it's like instant.
Thanks to the Vivaer device, it makes it so easy for everyone, right? So easy for the patient, so easy for the provider. Let's go and take a look on the opposite side. I think you just need about one treatment on this side, but let's take a look. 1 or 2 treatments. Here we are, before. We see exactly where we want to target there. Point to it on the screen. Alright, very good. And let's go for it. Alright, so we're going to go ahead and put the fuzzy right in that area. This is just lidocaine. okay, Rose?
I think so.
Okay. Go ahead and look away from me. Okay. You're a trooper. I know you're tasting it.
Mm-hmm.
Okay. Right up. A little more sensitive on this side.
Mm-hmm.
A bit along the other side. How are you?
I'm okay.
Good. I think you're good and ready. We're going to go ahead and start the procedure, okay?
Okay.
Ready, Riz?
Mm-hmm.
Good. Take a breath for me.
Wow.
You notice the difference?
Yeah. On both sides.
On both sides now. Last one, okay?
Yeah. Wow.
Better and better?
Yeah.
Nice. Okay. We're all set. Let's take a look. Here in the nose. You can see a big improvement already. Deep breath in through the nose. Good. Just do a little touch up here and there. I'm not gonna hold no. Something like that. Just a little touch up. If I do too much in that area, it's gonna swell up. But yeah, that's better. Breathe in through your nose. Yeah, really good. How does that feel to you?
I've never been able to take a deep breath like through my nose, and this is the first time I've been able to do that.
Amazing.
Yeah.
Amazing.
Absolutely amazing. Thank you, Dr. Zaghi.
Congratulations. Let's get Jen for you, okay?
Okay.
All right, Jen, we're all set.
Oh, yay!
Hear from your friend.
It was so easy.
How'd
I
you
didn't.
feel?
I can breathe through my nose for the first time.
Oh,
Like I was just telling
yay.
Dr. Zaghi, I've never been able to take a deep breath through my nose, and instantly, when he did the first time on my left, I was able to breathe.
Yay!
Yeah.
I'm so happy to hear that.
Amazing.
Thanks,
Our
Doc.
pleasure. And thanks to ViVier for all the great work they did to make this technology possible, as well as all the randomized controlled trials that we need to push the field forward.
Absolutely.
Awesome.
Thank you.
Thanks so much for participating
Yes.
and allow us to take this video to educate other people.